Welcome, everyone. I am Mary Funseth from Superior Health Quality Alliance. Today, we are having the third part of a series of conversations with Dan Michael, and it is about his perception of care, how he expects care, and today we're going to be talking with his daughter, Karyn. She's a very big part of his care plan. And welcome, Karyn. Thank you for
Thank you.
meeting with us today. And Dan, thanks for coming back and bringing your daughter.
I'm very happy to do so.
Okay, great. So the questions today will be aimed towards Karyn, and we will kind of check back with you in just a little bit, Dan. So Karyn, tell us about your relationship with your dad before he had some health needs, and then sort of contrast that with after his health needed some support with you, from you.
Sure. So we've always been close. I'm happy to help out when I'm needed. And the majority of the time, he is very independent in his healthcare needs and communication with providers. But there was a time he's willing to ask for and take help too, which I appreciate. About 3 years ago, he needed some assistance. There were a number of things going on. And so I was helping him with communication with providers. I created a chronology of events to help him kind of see the big picture. And but the great majority of the time, and since then, he is back to being independent with his healthcare issues and communicating with providers. So I'm here available as needed.
That's great. My next question is about how do you, I understand that you do work in healthcare. If you just take a moment and explain what is your role in healthcare at this time from a professional stance.
Sure. My background is in health information management. I have a bachelor's and master's from the College of St. Scholastica in Duluth. Although I took the same biology courses, anatomy, physiology, pathophys as the nurses and pre-med and PT students, my focus was on the health information management or medical record side of life. So I am not a clinician, but I did have a year of medical terminology courses. I ended up teaching medical terminology at local community college. And so that helps me understand the medical terminology that providers are using. Generally, they're pretty good about using language that makes sense, but it is a unique language. And so sometimes when I step in and ask a question and use medical terminology, they sit up a little straighter and kind of look at me like, oh, she knows a little bit more here. But they on the whole have done a good job of speaking in layman's terms, and that's helped me also hearing it both ways. So that's been an asset.
Great. Tell me a little bit about if there has been any difficulties that may have come up, in the interplay of being a health professional or in the healthcare world and then being a loving, supportive daughter.
So I can kind of see both sides. I see from a systems perspective. I've been in healthcare for 30 plus years, from the medical record or health information management side, and most recently in project management in information services for a large healthcare organization. So I've seen a lot of different systems and implemented a lot of different systems. So I can see that system perspective and how things should work, and then how things don't work sometimes. And helping my dad has made me help see the patient perspective a little more. One example I have was helping my mom. Actually, it was when he was in surgery, and we could see from the screen that he was in the recovery room. Well, he had been there an awfully long time. And so she was imagining all the worst case healthcare related scenarios. And I said, that could be, but someone would probably come out and tell us that. I said, it's more likely that maybe there's not enough clean beds on the unit where he's going to. Maybe there isn't enough nursing staffing and they want to make sure everything is ready for him. And so being able to see those both sides perspective of being anxious about him, and I was too, caring for him, but realizing that there's another side that could be just not totally related to him, but just a system thing. So so that's been helpful. Um, it's always interesting for me to see systems at work, because I see things more in the abstract as I plan and prepare for them as a project manager. But it's great to see systems working as designed in the real world for real patients. So
I love the fact that you shared that perspective when your dad was in surgery and you're waiting with your mom, and the fact that your mom was having the anxiety, as many would have the anxiety. And she was one of the lucky ones to get to have someone sitting by her side that may know a little extra about what's going on. And I think that's really something to point at for anyone viewing this video, to understand that not everybody has a Karyn sitting next to you, a daughter or a friend or advocate that really does know exactly the details. So having that extra support for those who may not have that is
right.
extremely important.
And I appreciate the flexibility, during COVID times. Um, he was in for some procedure, and they said one visitor only for the day, but they allowed me to be with her during the surgery and after, till the doctor came out and talked to us. And then she was the one that went back to his room, and then I just went home and came back later in the day to pick her up. So um, that flexibility of having a support person or people was really important. So,
Excellent. So you already talked about this a little bit, but when you're in a clinical visit with your, or attending a clinical visit with your dad, you talked about you're able to speak some of the language. So your health literacy level is a bit different than some folks who enter a room with a care team. Do you feel that there's been ever a time when you've had to pause the clinicians um, in what they're sharing with you, to remind them that you're also a daughter, and also that your dad is sitting there? He's the one that should be truly receiving the information. And of course, you're there as a support. So, is there anything that you could provide for clinicians as far as feedback or an idea on how to relay the information to a patient's family who's sitting with the patient at the time, especially with someone like yourself who has a higher health literacy level than others, possibly?
I think the most important part is that the patient understands the what is happening, or what has happened, or what will happen, and be clear. And then if someone like myself could ask follow-up questions, perhaps in a more detailed manner or in a more clinical terminology manner, that's helpful. But I think putting the patient first, and making sure that things are understood there before going into some of the nitty-gritty technical stuff is helpful.
Hmm.
So
Excellent. Thank you. So the last question for you today is, what do you need from clinicians that provide that care for your dad as a daughter? What do you need as a daughter and an advocate for your dad?
first of all, I want them to be thorough in their analysis and diagnosis, and to listen to him, to listen to what he is saying, to have some knowledge of him, and not just look at him superficially, and make assumptions. Getting to know him as a person, past history. One provider that actually we share was our orthopedist, who's since retired, used to always ask him what book he was reading, because you often wait for providers for a while. So that doctor took the time to always ask him what book he was reading, and discuss that a little bit first. And so that's very much appreciated. Also looking for coordination of care between providers. We are not simply one diagnosis, or there's not simply one aspect to our lives, that patients have multiple issues, and that things get coordinated between providers smoothly and seamlessly. So um, just because he's retired doesn't mean he's not busy. constantly on the go and doing things. And so the assumption that, oh, we've made the appointment for you, this is your time. Well, did you ever ask, did that work? Maybe he's going to be out of town. Maybe he's got other meetings, obligations, and things that are going on. So to not just assume that he's available because he's retired. So and then mostly clear communication. That could be verbally during the visit. That could be the patient portal, so he can ask questions ahead of time. He's very good about creating a list ahead of time um, for his monthly nurse check-in, or when he sees a provider about, this is what's been going on since I last saw you. These are my questions. Just want to let you know about this. But having that clear communication back as to what the plan is, whether that's the after visit summary, at clinic visits or discharge paperwork with the discharge instructions, having them be clear. And then just a clear plan for, this is what you should do, this is what you should not do. That can be followed by anyone. And not just someone that knows medical terminology or has a clinical background, but just having a clear plan and making sure that everybody understands what to do.
Great. Listening and taking the time.
Yes.
That is a big piece of what I'm hearing you say.
Mhm.
As also,
Yes,
of
exactly.
course, respect. Well,
Yes.
that concludes our questions for today. And I really want to thank you, Karyn, for coming on and thank you for supporting your dad's care. Uh, Great to have
course.
you a part of our series. And Dan, we want to continue to wish you well. There may be more coming from Dan in the future, but for today, we'll say goodbye to both of you and thank you again for your participation.
Thank you.
Thank you.